Hello, today we explore the dark truths behind one of history's most fascinating and controversial topics. We're delving into the opioid crisis, a modern-day plague that has ravaged communities across the United States and beyond. We'll uncover the role of Big Pharma in fueling this crisis and the factors that allowed it to spiral out of control. The origins of the opioid crisis. To understand how Big Pharma waged a war on America, we must first look at the roots of the opioid crisis. In the late 1990s, pharmaceutical companies began aggressively marketing opioid painkillers, such as OxyContin and Vicodin, as safe and effective long-term solutions for chronic pain. These claims were misleading, as we now know that opioids are highly addictive, and their long-term use can lead to dependency and withdrawal symptoms. The marketing campaign for OxyContin, in particular, was particularly deceptive. Purdue Pharma, the drug's manufacturer, launched a multi-million-dollar advertising campaign targeting both healthcare providers and patients. They claimed that OxyContin was less addictive than other opioids and that its extended-release formula made it suitable for long-term use. These assertions were later proven to be false, but by then, the damage had already been done. Big Pharma's marketing tactics to sell more opioids. Pharmaceutical companies employed deceptive marketing tactics, targeting not only patients but also healthcare providers. They hired armies of sales representatives to visit doctors' offices, offering gifts, speaking fees, and marketing materials to promote opioid use. Some companies even created fake medical associations to endorse their products. A 2017 article in The Washington Post revealed that pharmaceutical companies spent more than $2 billion on marketing opioids to doctors between 2012 and 2016 alone. Purdue Pharma is again a notable example. In addition to advertising directly to consumers, they targeted healthcare providers with lavish dinners, luxury trips, and even strip club outings. The company also hired speakers, often medical professionals, to give talks about the benefits of OxyContin, often without disclosing the speaker's financial ties to Purdue. Another tactic used by pharmaceutical companies was to influence medical education and guidelines. For instance, Purdue Pharma helped draft a letter to the American Pain Society, urging them to update their guidelines to include more aggressive treatment of pain. The letter was signed by prominent pain specialists, many of whom had financial ties to Purdue. This influence helped create an environment where opioids were seen as first-line treatments for chronic pain, further fueling the crisis. Regulatory failures. While Big Pharma was actively promoting opioids, regulatory bodies failed to act, allowing the crisis to escalate. The Food and Drug Administration, FDA, approved new opioids without adequate consideration of their potential for abuse and addiction. For example, the FDA approved OxyContin in 1995, despite concerns about its addictive potential. The agency also failed to require opioid manufacturers to conduct long-term studies on the drug's addictive properties. Meanwhile, the Drug Enforcement Administration, DEA, was slow to respond to the growing crisis. In 2007, the DEA proposed a rule that would have restricted the distribution of OxyContin and other extended-release opioids. However, the agency faced intense lobbying from the pharmaceutical industry and eventually withdrew the rule. It wasn't until 2014 that the DEA finally implemented new rules to limit the distribution of opioids, but by then, the crisis had already reached epidemic proportions. In some cases, regulatory bodies even enabled the crisis. In 2016, the Center for Disease Control and Prevention, CDC, issued guidelines for prescribing opioids, which were intended to help healthcare providers navigate the complex issue of pain management. However, these guidelines were criticized for being too broad and ultimately led to an unintended increase in the prescribing of long-acting opioids. An investigation by the New York Times revealed that pharmaceutical industry representatives had influenced the development of these guidelines, further highlighting the role of regulatory failures in the opioid crisis. The impact on communities. As opioid prescriptions soared, so did the number of people struggling with addiction and overdose deaths. Between 1999 and 2019, more than 400,000 people died from an opioid-involved overdose in the United States. This crisis has disproportionately affected rural and low-income communities, as well as certain demographic groups, such as Native Americans and veterans. For instance, in 2018, The age-adjusted rate of drug overdose deaths among Native Americans was more than twice the national average. The opioid crisis has also led to an increase in infectious diseases, with injection drug use contributing to the spread of HIV and hepatitis C between 2004 and 2014. The number of new HIV diagnoses among people who inject drugs increased by 223% in rural areas and 144% in urban areas. Similarly, the rate of hepatitis C infections among people who inject drugs has risen sharply, with an estimated 3.5 million people in the United States currently living with the disease. Furthermore, the crisis has placed a significant strain on healthcare systems, law enforcement, and social services. Emergency departments across the country have struggled to keep up with the influx of patients seeking treatment for opioid overdoses. In some areas, police and firefighters have had to carry naloxone, a medication used to reverse opioid overdoses, in addition to their usual equipment. The economic impact of the opioid crisis is estimated to be in the hundreds of billions of dollars. A 2017 study by the Council of Economic Advisors estimated the cost of the crisis at $504 billion in 2015 alone, with costs associated with healthcare, lost productivity, and criminal justice. The opioid crisis has also taken a toll on families and communities, with countless lives ruined by addiction and overdose deaths. Potential solutions and accountability addressing the opioid crisis requires a multifaceted approach, involving prevention, treatment, and harm reduction strategies. To prevent new cases of opioid use disorder, we must limit opioid prescriptions and improve pain management alternatives. This includes investing in research to develop non-opioid pain treatments and promoting the use of evidence-based pain management strategies, such as physical therapy, cognitive behavioral therapy, and acupuncture. We must also strengthen regulations and oversight of pharmaceutical companies. This includes holding pharmaceutical executives accountable for their role in the crisis and implementing stricter regulations on opioid manufacturing and distribution. Additionally, we must improve public awareness of the risks associated with opioids, ensuring that patients and healthcare providers are fully informed about the potential dangers of these drugs. For those already struggling with opioid use disorder, treatment options such as medication-assisted treatment and behavioral therapies can be effective. MET, which combines medication like methadone or buprenorphine with counseling and behavioral therapies, has been shown to reduce opioid use, improve retention in treatment, and decrease overdose deaths. However, access to these services remains a challenge, particularly in rural areas. To address this, we must invest in expanding access to MET and other evidence-based treatments, as well as improving the quality of care provided by treatment programs. Harm reduction strategies, such as needle exchange programs and overdose prevention sites, can also help save lives and reduce the spread of infectious diseases. Needle exchange programs provide clean syringes and other supplies to people who inject drugs, reducing the risk of HIV and hepatitis C transmission. Overdose prevention sites, also known as safe injection sites, provide a safe and supervised space for people to use drugs, with access to naloxone and other overdose prevention measures. While controversial, these approaches have been shown to be effective and cost-saving in other countries, and there is growing evidence to support their implementation in the United States. To hold those responsible accountable, we must support ongoing investigations and legal actions against pharmaceutical companies and their executives. In recent years, several states and local governments have filed lawsuits against Big Pharma and other opioid manufacturers, alleging that the companies engaged in deceptive marketing practices and downplayed the addictive potential of their drugs. These lawsuits have the potential to hold pharmaceutical companies accountable for their role in the crisis and secure much-needed funding for treatment and prevention efforts. Additionally, we must advocate for policy changes that prioritize the needs of those affected by the opioid crisis and ensure that regulatory bodies are held accountable for their role in enabling the crisis. This includes supporting legislation that would strengthen oversight of pharmaceutical companies, improve access to treatment, and promote evidence-based harm reduction strategies. The opioid crisis is a man-made disaster, fueled by the greed of pharmaceutical companies and enabled by regulatory failures. The consequences of this crisis are devastating and far-reaching, affecting individuals, families, and communities across the United States and beyond. To end this crisis, we must hold those responsible accountable, invest in evidence based solutions, and prioritize the needs of those affected by this devastating plague. We must also learn from the past and work to ensure that history does not repeat itself, as the lives of countless individuals depend on our collective ability to address the dark truths about the opioid crisis and take action to prevent future tragedies. If you have found today's video informative, please consider subscribing. Thank you for watching. Until next time. Good night.